My topic sentence hepatocellular carcinoma. My name is Denise Villon. Definitions. Hepatocellular carcinoma is a primary malignancy of the liver that occurs predominantly in patients with underlying chronic liver disease and cirrhosis. However, up to 25% of patients have no history of cirrhosis or risk factors for it.
David Robert Jones was born January 8th, 1947 in London. In high school, he got in a fight over a girl and was punched in the left eye, leaving that pupil permanently dilated and the appearance that one eye was a different color than the other. At age 15, he formed a band called the Conrads, and then a band called Davy Jones and the King Bees. After a couple of other bands, he eventually changed his stage name and set out on his own. He took dance lessons and appeared in television commercials in order to pay the bills. He got married, and then his musical career took off. He wrote songs and became a cutting-edge performer. Then he took up acting and starred in more than 24 movies. Over the nearly 50 years of performing, he won 6 Grammy Awards and sold 140 million records. 9 records went platinum, 11 went gold, and 11 went silver. Probably his most famous onstage creation was as an alien extraterrestrial from Mars. His musical style changed over the decades, much like a surfer, always catching the next wave, and he ultimately released 26 albums. But in 2014, he was diagnosed with hepatocellular carcinoma. And then 18 months later, on January 10th, 2016, David Robert Jones died of his cancer. But we all knew him by his adopted stage name, David Bowie. Hepatocellular carcinoma accounts for nearly 1 million deaths a year worldwide, and in many parts of the world, it's the most common cancer. Here in the United States, the incidence of hepatocellular carcinoma is rising. The way that we approach cancer of the liver has changed over the past 20 years, and today on MedNet, we're going to bring you up to date on the epidemiology, screening, diagnosis, and treatment of hepatocellular carcinoma. Joining us today is hepatologist and assistant professor of internal medicine, Dr. Lanla Conte. Lanla, welcome to the program.
Thank you, Jim.
Well, Lanla, why is the incidence of hepatocellular carcinoma so high throughout the world, and why is it increasing in the U.S.?
Absolutely. So even though HCC, hepatocellular carcinoma, is very common in the United States, it's actually more common in parts of Asia and Sub-Saharan Africa. And the reason for that is because of hepatitis B. Most of those places don't have access to hepatitis B vaccination. And in the United States, a big reason why it's increasing is because of fatty liver disease. We know NAFLD, non-alcoholic fatty liver disease, is increasing, and with that comes cirrhosis, which also brings HCC.
Well, 20 years ago, other than surgery, there was really nothing that could be done for patients with hepatocellular carcinoma. How has the treatment portfolio changed?
Absolutely. We have come a long way in the past 20 years. So now when a patient presents to clinic with a new diagnosis of HCC, we can walk them through all the methods of local regional therapy that we have available. And today we will be talking about some of those methods of local regional therapy for HCC management.
Well, thanks, Lanla. Before we get started, let me remind you that you can send us your questions about hepatocellular carcinoma by clicking on the email icon at the bottom of this webpage. And now let's get started with today's program. Lanla?
Applications in nursing. Evaluate and record skin characteristics, assess mental state, administer prescribed medications, evaluate the coagulogram daily.
Hepatocellular carcinoma is a type of cancer that arises in liver cells. It can sometimes be associated with chronic inflammation due to hepatitis and cirrhosis. And it can be a challenging cancer to deal with because patients have two things to deal with, usually the cirrhosis as well as the cancer. And traditionally there haven't been very good targeted therapies or chemotherapies for it, but In the past few years, we've seen a lot of new drugs developed for hepatocellular carcinoma, which is very exciting. For over 10 years, we only had one drug, and most recently, we have a new first-line therapy called lenvatinib, and we also have 4 other second-line therapies: regorafenib, cabozantinib, pembrolizumab, and nivolumab. So we've got a lot of new targeted therapies and immunotherapy, so it's a very exciting time for this type of cancer.
Pros and cons. Liver transplantation remains the best option for patients with HCC. Unfortunately, the supply of good quality disease donor organs is limited. Thus, other treatments, including resections, radiofrequency ablations, and potentially systemic therapy with sorafenib, or if sorafenib fails, with regorafenib, nivolumab, lenvatinib, pembrolizumab, cabozantinib, or ramucirumab should be used to bridge patients to transplant or to delay recurrence if possible.
Hepatocellular carcinoma is a primary cancer of the liver. It's a cancer that develops primarily in patients who have liver cirrhosis. It's the 3rd most common cancer in the world and one of the leading causes of cancer deaths. The reason it develops is because when patients become cirrhotic, their livers become nodular and inflamed, and tumors develop in these inflamed nodules. The major cause for hepatocellular carcinoma has been hepatitis C, which has been one of the leading causes of cirrhosis. But more recently, we're seeing increasing numbers of patients with hepatocellular carcinoma who have fatty liver disease and have fibrosis, not just cirrhosis. So any inflammation in the liver can cause these tumors to develop. For most patients with hepatocellular carcinoma that present to our center, we evaluate them for liver transplant if they come in in the setting of cirrhosis. The other option is surgical resection, or cutting the tumor out. And for those patients who are not suitable for transplant for one reason or the other, they may be suitable for a resection. Not everybody is suitable for resection, and it depends how bad the liver disease is, clearly. And the third modality is treatment from the interventional radiologist with either wires that go into the tumor and burn them from the inside with chemotherapy, or burn them from the outside through wires that come into the liver from the outside. All of these can be combined to get the best results for the patient. The advantage we have at New York Presbyterian for treating such a challenging disease is that the surgeons here are capable of resecting and transplanting the livers. We have experts in interventional radiology at treating these tumors. When you have a multidisciplinary team that's composed of surgeons who do research on the disease, who can cut the liver out or can transplant the liver, as well as hepatologists who are invested in researching the disease, and oncologists and radiologists, you get a better result for the patient overall. And the patient is directed towards the most appropriate care, rather than being filtered into what the center is an expert at. We're an expert at all 3 modalities of treatment rather than just the one.
Issue applied in Ecuador. At the hospital de Soca, Guayaquil, a total of 67 male patients with HCC were analyzed, with an average 64.6%, 31 or 86 years old. The 3% of patients originally from Guayas, 40% laborers, and 20% only studied elementary school. The associate due to hepatotropic virus, 32%, and insulin resistance, 25%. The most important risk factors combinations being excluded from the non-cirrhotic group.
Hepatocellular carcinoma. Chronic hepatitis B is the most common cause worldwide. Chronic hepatitis C is the most common cause in Europe. The main risk factor for developing hepatocellular carcinoma is liver cirrhosis, for example, secondary to hepatitis B and C, alcohol, hemochromatosis, and primary biliary cholangitis. Features. Tends to present late. Features of liver cirrhosis or failure may be seen: jaundice, ascites, right upper quadrant pain, hepatomegaly, pruritus, splenomegaly. Possible presentation is decompensation in a patient with chronic liver disease. Screening with ultrasound, with or without alpha-fetoprotein, should be considered for high-risk groups such as patients with liver cirrhosis, secondary to hepatitis B and C, or hemochromatosis. Men with liver cirrhosis secondary to alcohol. Management. The only proven potentially curative therapy for hepatocellular carcinoma remains surgical. Either hepatic resection or liver transplantation. Hepatic resection should be considered as a primary therapy in any patient with hepatocellular carcinoma and non-cirrhotic liver. Liver transplantation should be in any patient with cirrhosis and a single small hepatocellular carcinoma less than 5 cm, or multiple up to 3 lesions less than 3 cm. Non-surgical therapy is only used when surgical therapy is not possible, and with extrahepatic dissemination. Percutaneous ethanol injection has been shown to produce necrosis of small hepatocellular carcinoma, and is best used in peripheral lesions. Transarterial chemoembolization can produce tumor necrosis, and has been shown to affect survival in highly selected patients with good liver reserve. Radiofrequency ablation. Systemic chemotherapy has a poor response rate. Sorafenib, a multikinase inhibitor. Interferon has been used as the treatment of hepatocellular carcinoma, rather than the underlying viral infection, but remains controversial. Thank you for watching. New videos are uploaded regularly. Don't miss them. Click the subscribe button below, and get the new videos easily.
Conclusion. Hepatic resection and transplantation remain the cornerstone curative therapies for patients with HCC. In patients with early-stage tumors and advanced liver disease, transplantation is clearly the treatment of choice with 5-year survival rates of roughly 70%. Liver transplantation, however, is limited by organ shortage and the inherent risk of transplantation and immunosuppression.
Hello guys, this is Indian Medico, and in this video we are going to see about hepatocellular carcinoma. Hepatocellular carcinoma is abbreviated as HCC. It is the most common primary malignant tumor of liver in adults. Now let us see about the risk factors for developing HCC. Alcoholic cirrhosis, hepatitis B virus, hepatitis C virus, hemochromatosis, Wilson's disease, alpha-1 antitrypsin deficiency, and hepatic carcinogens like aflatoxin are the various risk factors for developing hepatocellular carcinoma. Now let us see about the pathology of hepatocellular carcinoma. Cross specimen may show a single mass or multiple masses or infiltrative carcinoma. This picture shows an autopsy specimen of hepatocellular carcinoma. The liver may be pale and green tinted. Now let us see about the microscopic features. There may be cords or sheets of cells roughly resembling hepatic parenchyma. There can also be anaplastic masses. This picture shows trabecular pattern of hepatocellular carcinoma. It may invade portal veins or inferior vena cava. Now let us see about the metastasis. It can undergo hematogenous dissemination to lungs, vertebrae, adrenals or brain. Now let us see about the clinical features of hepatocellular carcinoma. Fever, weight loss, worsening hepatomegaly, worsening or bloody ascites, and cirrhotic symptoms are the various clinical features of hepatocellular carcinoma. Now let us see about the laboratory findings of hepatocellular carcinoma. Elevated alpha-fetoprotein, leukocytosis, anemia, and sudden elevation of alkaline phosphatase are the various laboratory findings of hepatocellular carcinoma. Now let us see about the treatment of hepatocellular carcinoma. The various treatment options include surgical resection, chemotherapy, radiotherapy, and liver transplantation. Now let us see about the prognosis of hepatocellular carcinoma. Death often occurs within 10 months of diagnosis in case of hepatocellular carcinoma. If you have any suggestions, please let me know in the comment section. For more such videos, please check out my playlists. If you like my videos, kindly subscribe. Your subscription will encourage me to make more videos. Thank you.